Hello everyone and welcome back. Within this week's lecture, we will be covering the topic of differential reinforcement, which corresponds with chapter 25 of the Cooper, Huron, and Heward textbook. The TCO item that will be covered within today's lecture is G18 from the Behavior Change Procedures section, and that specific TCO item says to develop and implement differential reinforcement procedures with and without extinction. Okay, so let's get started. So in the last few weeks, we've covered several different interventions that you can use within the field of applied behavior analysis if you are targeting a behavior for reduction. So some of those interventions that we've covered are punishment and extinction, amongst with some different applications or combinations of interventions that we've also discussed. But these different interventions often have unwanted side effects. So we talked about some of those extensively last week. I mentioned the side effects of extinction can include an extinction burst where we see a worsening or an increase in the behavior. We can see a worsening in the magnitude of the behavior. We will often see emotional reactions as well. And the same can be said for punishment. So with punishment, although we do see rapid reductions in behavior, we also will traditionally see emotional reactions as well. And maybe some escape maintained behavior as well. And so, these interventions can be very effective. And as I've mentioned in the previous lectures, we'll have a time and a place where you deem that these are appropriate interventions for your client, but they won't be or shouldn't be the immediate go-to intervention in many cases. So within today's lecture, we will talk about what other interventions, what other intervention options do we have? Okay, so before we get started with discussing the new intervention that we'll be covering in today's lecture, I want to make sure that you all, understand or remember that if you have a maladaptive behavior that's occurring in a person's repertoire, right? You have a person that's engaging, let's say, in frequent throwing of objects or yelling, or they're engaging in aggression or whatever it may be, whatever maladaptive behavior a person is engaging in, and they are consistently engaging in that behavior, that behavior has a history of reinforcement, which means that behavior in some way has been contacting reinforcement, for however long it's been occurring. Sometimes a behavior has been occurring for a short period of time. Other times the behavior has been occurring for a long period of time. The important point that I want to drive home here is that if a maladaptive behavior is occurring, it's occurring because it's contacting reinforcement in some way. Okay, so as we go through today's lecture, I want you to think about, different behaviors and consider that every single behavior that's occurring in a person's repertoire has a history of reinforcement, and that history of reinforcement will contribute to that behavior continuing to occur. Okay, so now, is there an intervention that can mitigate those unwanted side effects, from extinction and from punishment, which include emotional behavior, and also help us to reduce a maladaptive behavior? Okay, so the answer here is yes. We can use differential reinforcement to help us reduce a maladaptive behavior while also mitigating those side effects of extinction. So what exactly is differential reinforcement? Differential reinforcement is when we are reinforcing one response class and then we are withholding reinforcement for another response class. Okay, so a more technical definition, or what the process generally looks like, and I'm saying generally or often looks like, is when we are providing reinforcement for behaviors other than the problem behavior. So what this means is you have different behaviors, not the problem behavior, but you have different behaviors that you're providing reinforcement for. Those can be specific behaviors. Sometimes it's just general behaviors, or in other cases, it's an incompatible behavior. Or, when you are providing reinforcement for the problem behavior occurring at a reduced rate. We'll discuss what that looks like. And so this is like the first component of differential reinforcement. And then the second component is this. So, and we withhold reinforcement for the problem behavior. Okay. And it has a little asterisk next to it because, as I said, differential reinforcement often involves these two components, but there are exceptions to this. So we're not always withholding reinforcement. We are, in most cases, withholding reinforcement, meaning extinction. We're implementing extinction for the problem behavior, but this is not the case all the time. Okay, there is, I don't want to confuse you all, but we'll discuss a variation of differential reinforcement in the future. But most of the time when we are referring to differential reinforcement, it means that we are providing reinforcement for, different behaviors, not the problem behavior. And we are, putting the maladaptive behavior or the problem behavior on extinction. That's generally what we're referring to. But there are different variations of differential reinforcement. So we're going to talk about all the different variations of differential reinforcement. And then hopefully, once we cover the different variations of differential reinforcement, this definition will make more sense to you all. Okay, so here is a list of the different procedural variations of differential reinforcement, or the DRs. So really, I like to think, I've mentioned this to you all before, but I like to think that the different terms that we use in behavior analysis often can help us to identify the procedures, or to be able to more quickly define the procedures. I like to associate definitions with, the terms or with keywords, etc. So I think differential reinforcement procedures are the titles of each of these each tell us what the procedure does, in my opinion. So, starting off with differential reinforcement basically means that we're differentially reinforcing the maladaptive behavior in some way. Usually we're applying extinction to the maladaptive behavior or the problem behavior. And then the appropriate behavior or other behaviors have a different schedule of reinforcement that they're receiving, and we are usually trying to target those for increase. Okay, so to me, differential reinforcement, that's all it means. We are differentially reinforcing two different behaviors, the maladaptive behavior and then the behaviors that you're targeting for increase. Okay, and now we have different procedural variations of differential reinforcement. So we have our differential reinforcement of other behaviors. We have our differential reinforcement of incompatible behavior, differential reinforcement of alternative behaviors, and then this one is this is specifically with extinction, and then we have differential reinforcement of lower rates of behavior, which is without extinction. And I'm going to go through what each of these means, but I really quickly want to highlight the abbreviation for each of these. So differential reinforcement of other behaviors, the abbreviation is DRO. Differential reinforcement of incompatible behavior, the abbreviation is DRI. Differential reinforcement of alternative behaviors is DRA. And then differential reinforcement of low rates of behavior is DRL. So let's get into what each of these different procedural variations looks like. So the first variation of differential reinforcement that we will learn about today is differential reinforcement of alternative behaviors. Like I mentioned, the procedure is listed in the name itself. So differential reinforcement of alternative behaviors, or DRA, is when you reinforce occurrences of a desirable alternative behavior to the problem behavior, and we also withhold reinforcement for the problem behavior. Okay. With DRA, okay, you have to make sure that you're selecting. Well, first of all, you would have to know what the problem behavior is, and you typically want to also identify what the function of that behavior is. Once you know the function of the behavior, then it becomes easier to select an alternative behavior that you want to target for increase. And usually it's a desirable, obviously, if you're targeting a behavior for increase, you would want that behavior to be a desirable behavior that you would want your client to engage in. And then you would go ahead and reinforce that behavior pretty heavily. And the other behavior you would place on extinction, or in some cases, you will just reinforce that behavior at very low rates. And I'll talk about that a little bit more later. So basically, differential reinforcement of alternative behaviors involves two behaviors that are occurring at the exact same time, or can occur at the exact same time, meaning that there is a schedule of reinforcement available for each of those two behaviors at any given time. What this means is you can engage in one behavior and access one reinforcer or one schedule of reinforcement or of punishment or a schedule of extinction or whatever it might be. Or you can engage in the alternative behavior and, again, contact either reinforcement, punishment, extinction, or whatever it might be. That's what a concurrent schedule is. It's basically when you have two behaviors that can occur at any given time and they each result in their own schedule of reinforcement. So in the case of differential reinforcement of alternative behaviors, we have the two behaviors that we have are a maladaptive behavior, okay, or a problem behavior, and then we also have our alternative behavior, our desirable behavior that we're targeting for increase. So in this example, you can have the behavior of yelling when you want something. That's, obviously not appropriate in many cases, unless you're in a room where you can't hear anything, and so yelling across the room would be considered appropriate. But let's say that just yelling in your day-to-day life at people when you want something, that wouldn't be deemed appropriate usually, and so this would be a behavior that we could target for decrease. So with this concurrent schedule, we would basically place this behavior on extinction. Okay, so if we were to implement differential reinforcement of alternative behavior, if we were to implement DRA, we would place the yelling on extinction, and then we would place the alternative behavior of asking politely for the item on a very high reinforcement schedule or a dense reinforcement schedule. And sometimes, in some cases, this behavior won't be occurring naturally, and so we will, prompt the client to engage in the behavior so that we get the opportunity to reinforce the behavior. And then we want to reinforce the behavior very, very heavily, high quality reinforcement. I have some more on that in the next slide. And so then what results usually is we'll see a decrease in the maladaptive behavior. So the yelling will decrease, and then we'll see an increase in the appropriate behavior, in the alternative behavior that you've been reinforcing. So that behavior of asking in this case will increase. So why is this effective? Why does this work? Like I said, we have our concurrent schedules of reinforcement, which is when we have two behaviors that can occur at any given time, and each of those behaviors will receive reinforcement at different rates, or will contact some schedule of reinforcement, whether it be, it's contacting extinction, or it's contacting reinforcement, or whatever it might be, okay? Well, in the case of DRA, the alternative behavior is going to be receiving a dense reinforcement schedule, meaning very high rates of reinforcement. You're very frequently reinforcing the behavior, or in most cases, you're providing continuous reinforcement for that appropriate alternative behavior that you're trying to increase. And that behavior is going to be that reinforcement is going to be very high quality. Okay, so what could that look like? Let's say that in this case, you have tantrums that you're targeting for decrease. That's your maladaptive behavior. And then we have functional communication. So instead of engaging in a tantrum, we would expect you to communicate appropriately what it is you want. So this behavior of functional communication is going to result in more of the desired item or more frequent reinforcement. We're going to give better versions of the desired item, so higher quality reinforcement. Okay, the person's going to engage in functional communication and access better reinforcers, and they might even access the reinforcer for even longer just because they engage in this appropriate behavior. Whereas the maladaptive behavior, we want to either place it on extinction, meaning that they're not going to access reinforcement for that behavior at all, or we're going to place that behavior on a very lean schedule of reinforcement. And a very lean schedule of reinforcement basically means that we're going to provide minimal reinforcement for that behavior. And when we do provide reinforcement for the behavior, it's going to be very low quality reinforcement, okay? Differential reinforcement of alternative behaviors, typically when people are saying DRA, they mean that one behavior is being placed on extinction and one behavior is being targeted for increase and receiving high quality reinforcement. But as you can see here, you can also have differential reinforcement without extinction. So that's what this is, where the maladaptive behavior is receiving such low quality reinforcement that the behavior is so it's not worth it anymore. It loses the value. So let's go into this next point. Why does this work, right? Why would it be okay for us to provide reinforcement, even if it's in very low rates, for a problem behavior? Well, the reason is because of the matching law. So if you recall what the matching law is something that behavior analysts identified as a principle that governs behavior, and that tells us basically reinforcement, our behaviors will match the level of reinforcement that they receive. Okay, so behavior, there's like that famous quote in ABA that says behavior goes where reinforcement flows. Basically, if you receive really high quality reinforcement for a particular behavior, you're more likely to allocate your responses towards that particular behavior because you're receiving high quality reinforcement or reinforcement very frequently. Whereas if you have a behavior that you're receiving very low quality reinforcement and very infrequent reinforcement, you may still allocate some of your responses to that schedule, but it'll be very minimal. Or what'll happen is you're just going to allocate the majority of your responses, or all of your responses, to a schedule where you're receiving very high quality reinforcement. Okay, so that's why this is okay. And I'm highlighting differential reinforcement without extinction because many people have the misconception that differential reinforcement must include extinction, and that is true in many of the applications of differential reinforcement. But I also want you to know that you don't always need to place your client's behavior on extinction. And sometimes it is going to be more humane and more appropriate for a client for you to continue to provide very minimal reinforcement for some of their behaviors, so that they're not experiencing that extinction burst and they're not experiencing the emotional reactions and the emotional outbursts, or the increase in magnitude of the problem behavior. Because as I've mentioned in the extinction lecture, sometimes that's just not appropriate for the client, for the client's caregivers, for the setting that they're in. And so, in some instances, you will opt for using a differential reinforcement procedure that does not involve extinction. And yes, you will be reinforcing the behavior, but that reinforcement will be minimal. And because of the matching law, that client, as long as you do it appropriately and you allocate the majority of your reinforcement and the high quality reinforcement towards the appropriate behavior, your client will then begin to allocate their responding towards that appropriate alternative behavior that you're trying to teach, and then their problem behaviors will reduce. Okay, let's talk about what that reduced reinforcement will look like. So it looks like less of the desired item. So you see here, if they engage in tantrums, they'll receive less of the desired item or less frequent reinforcement. And another alternative would be to provide shorter time with the desired item. For those of you that are RBTs, I want you to consider how often you're implementing extinction in your practice, and consider whether, for your clients, if you have any clients where differential reinforcement without extinction might be an appropriate intervention. And you can learn a little bit more about differential reinforcement through looking up articles on differential reinforcement without extinction. It's actually a procedural variation of differential reinforcement that is minimally covered in the Cooper textbook because it's a newer intervention. And so you can find more on this procedural variation on, through journal articles. You can find more on this maybe on YouTube, but I encourage you to learn more about differential reinforcement without extinction so that you are, using more compassionate interventions with your clients, more humane interventions with your clients that does consider how they feel, how they perceive, the interventions that we are applying to them, and also so that we can be more considerate of our caregivers also, and what they feel that they can reasonably implement. Like I mentioned, there will be some caregivers that will tell you, I simply can't see my child cry. I simply, can't tolerate them engaging in X, Y, and Z behavior. I would hate for them to experience an extinction burst. I would hate to see emotional reactions from them. And so in those cases, differential reinforcement with extinction simply won't be appropriate for them. And so you have to have the tools in your toolbox to support those families that require more compassionate or more humane treatment, which I think should be the default anyway. And then if needed, you should add the extinction component. But yeah, definitely do some more research on those topics if you're already practicing in the field. Okay, so now that we've talked a little bit about differential reinforcement of alternative behaviors, I want you to do like a little exercise where you consider the following problem behaviors and their function, and then you tell me what replacement behaviors might you teach for these specific problem behaviors, okay? And remember, you're going to try to you have to select an alternative behavior that's appropriate and that's desirable, one that can be reinforced at a very high magnitude, that can be reinforced very frequently, so that what can happen is we can displace the amount of reinforcement that they're receiving for the maladaptive behavior. Okay, so the first example says throwing objects that are not meant to be thrown. So let's say that you have a client that is engaging in throwing of objects. They're not supposed to be throwing them. Think of anything in their environment. They're simply grabbing it and throwing it. And this behavior has been found to be maintained by automatic reinforcement. So if something about the behavior feels good, smells good, whatever it might be, but they're throwing for automatic reinforcement, what replacement behavior might you select if this were your client? Okay, I'm going to go ahead and jump in here. So if this were my client, I would probably teach them appropriate ways to throw. Okay, throwing is throwing objects that are not meant to be thrown is not an acceptable behavior, but I can teach them to throw with objects that are meant to be thrown. So I would reinforce, throwing basketballs, throwing a tennis ball, throwing different kinds of balls. I would teach maybe the appropriate context within which you can throw, and I would reinforce in that context. But throwing objects not meant to be thrown would no longer contact reinforcement. The next behavior is getting out of the seat. You have a client that's getting out of their seat while they're working on a difficult task. So when you present a task that is, maybe too difficult or too challenging for them, they get out of their seat and they walk away. And this behavior has been identified as being maintained by escape. What would you do in this particular situation if you were using DRA? What replacement behavior would you select to target for increase? Okay, I'm going to jump in here now. So there are many different behaviors that you could select in this case. You could teach them to request escape, right? Demanding for escape could be a good alternative behavior. You could teach them to ask for help. You could teach them to ask for a break. You might teach a few of these at the same time, right? These are those self-advocacy skills that we would want our clients to have. These would be great replacement behaviors for if you were targeting this behavior for reduction, and you wanted to also increase an alternative behavior. So, there could be many right answers in this case. And then third behavior says you have a client that engages in tantrums after being told to transition to a different area and give up their preferred item. So they're playing with their toy. And then they now have to put their toy away and transition to somewhere new. So the behavior is maintained by access to tangibles. What replacement behavior could you teach in this particular case? Okay, so with this example, some replacement behaviors that I might teach that match the function of the behavior would be to request maybe more time within that activity. So I might teach the client to say, can I have 2 more minutes with this toy? Or I might teach the client to say, I'm not ready to go yet. I would basically try to teach those self-advocacy skills of saying, I'm not ready to give up this item yet. And then I would also heavily reinforce appropriate transitions. So after I've taught them to demand for more time, to maybe express their emotions, say we could even teach them to express their emotions. We could teach them to say, it makes me really sad to have to give up my item. I could teach them to, like teaching tacting emotions would be a good alternative behavior here. And then also encouraging a transition after teaching that tact to emotion. Or after they request more time with the item, let's say they request 2 minutes with the item and that time is up, I could reinforce obviously the requesting of the item with more time with the item, but then I would also want to encourage appropriate transition afterwards. So then I would heavily reinforce that. And I wouldn't reinforce the tantrum with continued access to the tangible. What will only result in access to the tangible would be them requesting more time with the tangible. I would give them a few extra minutes, and then we would transition appropriately after that. Okay, so sometimes these alternative desirable behaviors that we're targeting for increase can't occur at the same time as the problem behavior. I'll give you guys an example. So let's say that I have a client that engages in inappropriate vocalizations. They are cursing, they're saying whatever it might be. They're cursing, they're saying nonsensical things, whatever the topography of the behavior might look like. Let's just say the label is inappropriate vocalizations. And I select an alternative behavior to target for increase. Well, that alternative behavior might be appropriate vocalizations. So, communicating things that are considered appropriate, like demanding for items, labeling things, engaging in a conversation with somebody. Maybe we consider those as appropriate vocalizations, okay? Well, these two behaviors cannot occur at the same time, right? You can't engage in appropriate vocalizations and inappropriate vocalizations at the same time. That basically means that the appropriate behavior is an incompatible behavior, okay, to the maladaptive behavior. That's, it just means that they can't occur simultaneously. So this is actually known as a procedural variation of DRA. And this procedural variation is called differential reinforcement of incompatible behavior, or DRI. The procedure is exactly like DRA. So you have the maladaptive behavior that you're placing on extinction, or you're reinforcing at very, very low rates. Usually when we talk about, like I said, differential reinforcement of DRA, we're talking about with extinction, but I just want you all to know that that's like a variation of it. But anyway, differential reinforcement of incompatible behavior involves the behavior being placed on extinction, and then the maladaptive behavior, the problem behavior being placed on extinction, and then that alternative behavior that you selected for increase is going to be reinforced heavily, but it's also an incompatible behavior because it cannot occur along with the problem behavior. That's all it is. That's the only difference between DRA and DRI. So let's talk a little bit more about differential reinforcement of incompatible behavior. And as you just saw in that little image, you have a person that's trying to fit a rectangle into a circular, cutout, and that's not going to work. Well, that's because with an incompatible behavior, the person's not able to engage in the incompatible behavior that the appropriate, alternative incompatible behavior that you've selected. They're not able to engage in that behavior at the same time as the maladaptive behavior. So here's an example of what that would look like. Let's say that you have a student that puts their head down and they sleep. What would be an incompatible behavior? Well, in this case, reinforcing staying awake. You can't stay awake and be asleep at the same time. Okay, so this would be an example of DRI. Okay, for this exercise, I want you to think about what is incompatible with each of these particular topographies of behavior. So the first one is being out of one's seat. What is incompatible with that? What is incompatible with having one's hand in their mouth? What is incompatible with cutting class? What is incompatible with making rude remarks when given a direction by a teacher? And again, what is incompatible with hitting oneself on the side of the head with fists when presented with a task? Please go ahead and respond to this with your best incompatible behaviors. Okay, so now that you've learned about DRA and DRI, I want to make sure that we talk about the guidelines for using DRA. So if you're going to be designing a differential reinforcement of alternative behaviors intervention, or a DRI intervention, you want to make sure that you're selecting the alternative behavior that you're going to be targeting for increase. You want to make sure that you are selecting a potent reinforcer and delivering them consistently, that you're reinforcing alternative behavior immediately and consistently, that you're withholding reinforcement for the problem behavior, that you are careful with treatment relapse, just as you would with extinction. You have to be concerned with resurgence here, and that you are combining your DRA with other procedures if necessary or if appropriate. And then if you are designing an intervention for like a DRI intervention, your behavior, your alternative behavior, you just want to obviously make sure that it's an incompatible behavior. So when you are selecting the alternative behavior, you want to ideally select a behavior that already exists in the learner's current repertoire. You want a behavior that is not as effortful as the problem behavior itself, because if the behavior is less effortful than the problem behavior, then the client is more likely to want to engage in that behavior, especially if that behavior results in a high rate of reinforcement. But we definitely want a behavior that's easier to engage in than the problem behavior itself. We want a behavior that occurs frequently enough to provide sufficient opportunities for reinforcement. And if that behavior doesn't occur often enough, then it's okay for you to go ahead and prompt that behavior in order for the learner to engage in that behavior and then be able to access reinforcement. And lastly, you also want to make sure that you're selecting a behavior that's likely to be reinforced in the client's natural environment. So you want to select a behavior that's contextually appropriate for that client. Maybe you've asked caregivers or the teacher what behavior they're likely to reinforce in their environment, or that maybe their peers are likely to reinforce, etc. Depending on the context of the behavior in which it occurs and who would be reinforcing the alternative behavior. Well, you want to consider what response are they likely to reinforce, because that's the one that will contact reinforcement in the natural environment. If you create this perfect, beautiful intervention, you teach this replacement behavior that's not likely to be reinforced by caregivers because maybe it's not appropriate based off of their culture, or what they as parents feel comfortable reinforcing, or the teacher feels comfortable reinforcing, then you've wasted all this time teaching a new behavior that's not likely to contact reinforcement in the natural environment. And so the maladaptive behavior will likely continue to occur if that's the one that will contact reinforcement. And then whenever possible, you want to differentially reinforce alternative behaviors that are going to lead to or increase the learner's opportunity to acquire useful skills. So if it leads to adaptive behavior in some way, or to more communication, or better communication, or the ability to acquire new skills, well, that's the behavior that you typically want to select for increase. Now, once you know exactly which behavior you're going to be targeting for increase, then you want to make sure that you're selecting potent reinforcers and that you're delivering them on a consistent basis. You might conduct a preference assessment to determine what are the most preferred items, what item or what activity or reinforcer is likely to heavily reinforce that particular behavior that you're selecting. You want to make sure that you're selecting reinforcers based off of the client's motivating operations, that you are selecting reinforcers that are likely to exist and be supported in the natural environment. You also want to, whenever possible, select an alternative behavior that matches the function of the problem behavior, so that the reinforcer, the reinforcer that's maintaining the problem behavior is also the reinforcer that they're going to receive for engaging in the appropriate alternative behavior. Because the consequence that's maintaining the problem behavior prior to intervention is going to be the most effective reinforcer. When we have, this is what we call function-based interventions. When we have an intervention that matches the function of the behavior, it's more likely to be effective. Okay, so all this means is that we want the behavior to match in function, and the reinforcer to be the same reinforcer that they received for the problem behavior. So, in the example of the tantrums that are maintained by escape, if you have a client that's engaging in tantrums to escape a difficult task, well, we could also teach the alternative behavior of requesting a break. And the reinforcer is the same. The reinforcer is escape for requesting a break. They'll get a break from the difficult task. So that response requires minimal effort, right? All you have to say is, I need a break, rather than engaging in a 15-minute tantrum. And the reinforcer is exactly the same. So they're going to get escape from that task, at least momentarily. They'll be able to delay the task. And then you want the magnitude of the reinforcer to be a very high quality reinforcer and to be delivered consistently, so that they're accessing reinforcement almost on a continuous basis for this alternative behavior. And what you want to do is kind of shift the scales, where they're receiving very, very, very high quality frequent reinforcement for that appropriate alternative behavior, and no reinforcement or minimal reinforcement for the problem behavior. You also want to make sure that the reinforcement for the alternative behavior is immediate and consistent, like I just mentioned. So the stimulus change selected by the practitioner must be one that can be delivered immediately and consistently when the alternative behavior occurs, and a continuous schedule of reinforcement should be used initially. Once the behavior is established in a person's repertoire, the alternative behavior is established in the person's repertoire, then you can go ahead and transition into an intermittent schedule of reinforcement. And as I've been mentioning throughout the last few slides, you also want to make sure that you are withholding reinforcement for the problem behavior, because the effectiveness of DRA is going to depend on the alternative behavior yielding a higher rate of reinforcement than the problem behavior. Ideally, the alternative behavior will always receive reinforcement, at least initially. Okay, once that behavior has been established in the person's repertoire, okay, you can move on to an intermittent schedule of reinforcement. And then the problem behavior would always be on extinction. Again, this is ideally. Remember that I've been, mentioning that you're not always going to be able to place the problem behavior on extinction, and so you'll just reinforce it at a very low rate with, a low quality reinforcer, etc. And then you also want to make sure that you are watching for treatment relapse. Behavior that has been previously reduced by DRA may occur frequently when the reinforcement schedule for the alternative behavior is thinned, meaning if you are moving from continuous reinforcement to intermittent reinforcement for that alternative behavior, you have to be careful not to thin the schedule of reinforcement or deliver reinforcement too infrequently, because this can basically cause the problem behavior to start occurring again. You might also see the problem behavior start occurring again if you're moving, settings when you're implementing your DRA intervention. So if you've taught DRA in a very contrived manner, at the table or, in a clinical setting, and now you're trying to move to the natural setting, you might see some relapse in the problem behavior again, meaning that the problem behavior will come back and start occurring again. And you can also see this happen when you add in new people into your environment. So when you add a new therapist or a new caregiver or a new teacher or whoever into the environment, and you're trying to generalize the intervention over to them, the client might test the waters. They might have a history of reinforcement with those different individuals, or they might not. They might just have met them, and so they might resort to engaging in the problem behavior again to see if they get access to reinforcement. It's almost like they're testing the waters to see what they can get away with, but it's critical that those people continue to maintain the intervention, the DRA intervention, and that they're reinforcing the appropriate alternative behavior rather than the maladaptive behavior, so that we see those that maladaptive behavior go down again, and the appropriate alternative behavior increase again. And then it's also really important that if you are, transitioning into a new setting, or if you are going to be working on generalization to different people, where you're going to be training different individuals to implement the intervention, you want to make sure that you are training them thoroughly on how to implement the intervention. Don't just assume that people are going to that people are going to know exactly the behavior you're targeting for increase and the behavior that you're not reinforcing. They might inadvertently reinforce a problem behavior, which means that then you've placed your problem behavior on an intermittent schedule of reinforcement, which we know is, going to be it basically helps that behavior remain in that person's repertoire, and we don't want that. Because by placing that problem behavior on an intermittent schedule of reinforcement, it's going to become established in their repertoire, and it's going to weaken or compromise your DRA contingency. We don't want that. It's going to make it more resistant to extinction. We prefer for people to be as consistent as possible with implementation, and for that behavior to not contact reinforcement whenever possible, if you are using DRA with extinction. Okay, so as I mentioned, treatment relapse is going to look very similar to the side effects that we saw during extinction, which is resurgence. So resurgence is the reoccurrence of a previously reinforced behavior when reinforcement for an alternative behavior is terminated or decreased. Okay, so basically we're going to see that if you recall in the extinction presentation, there's like a small little jump in the graphs where the behavior has previously, stopped occurring, and then it begins occurring again. As long as you remain consistent with your implementation of the intervention, you should see that behavior go back down to 0. But if you don't train the different people in your environment, and then that behavior starts to contact reinforcement again, that behavior is going to go up again. So let's review really quickly the factors that may influence resurgence, okay? So the different factors that may influence resurgence are the magnitude of reinforcement for the alternative behavior. If you, for whatever reason, diminish the magnitude of the reinforcement, it's not as high quality anymore, or if they're not receiving it as often as they were before, so the thinning of the schedule of reinforcement, that may cause the behavior to come back. If the response effort for the alternative behavior is too high, right, then that on its own may, have an effect on the problem behavior, and the problem behavior may start occurring again. And then lapses in treatment integrity are what I mentioned, where if you have your intervention that you've designed and it's not being designed as it was intended, it's not being implemented as it was designed to be implemented, then you'll see the behavior start occurring again. Okay, and so then one thing that you can do to help your intervention be a little bit more effective would be to combine DRA with other procedures. So DRA interventions do not specifically provide consequences for the problem behavior, right? All we're doing is withholding reinforcement or like implementing extinction. So a practitioner might combine DRA with other reductive procedures if they see that the extinction alone is not effective. So they might decide to use a differential reinforcement of alternative behaviors where they're reinforcing the alternative behavior really heavily, and then the maladaptive behavior or the problem behavior is resulting in some other consequence, which could be response blocking, or it could be timeout, it could be stimulus fading, or differential reinforcement of other behavior. Okay, so sometimes you might have to combine your differential reinforcement procedure with another procedure like a punishment procedure to make that behavior go down in its entirety. Okay, so now we're going to talk about another procedural variation of differential reinforcement, and this is known as differential reinforcement of other behaviors, or DRO. And DRO is when we deliver reinforcement contingent on the problem behavior not occurring throughout an interval of time or during a specific time, okay? So basically what we're doing with differential reinforcement of other behavior is we are reinforcing the absence of the behavior, the absence of the problem behavior. So with differential reinforcement of alternative behavior, we're selecting a very specific behavior to increase, an alternative behavior that we want to increase. Whereas with DRO, okay, we're not selecting any specific behavior that we want to increase. We're only deciding, okay, whenever the problem behavior is not occurring, that's when we're going to provide reinforcement. And then there's specific variations actually of DRO itself. So we have interval DRO, and then we have momentary DRO. And actually between each of these, there are even more specifics that we can break these down into. So I'll give you the general overview of each of these, and then we'll get into the specifics in the next few slides. So interval DRO is when we break down, so as I mentioned, DRO is when we deliver reinforcement contingent on the problem behavior not occurring throughout intervals of time. And you might be questioning, well, what does that mean? Well, let's say that you have a specific observation period, and your observation period might last for 10 minutes, right? 10 minutes. Okay. And this is minute 0, and that's minute 10. We can split up our observation period into different intervals. So this would be minute 1, right? Minute 2, minute 3, minute 4, minute 5, minute 6, minute 7, minute 8, minute 9, and then minute 10 would be over here. Okay, so this would be considered, this entire thing would be considered our observation period. And each of these, okay, each of these so this would be 1 minute, right? Each of these would be considered an interval. So this first one here would be 1 minute, and this, hold on, let me see if I could, actually, let me use a different color. Okay, this here would be our first interval. This here would be our second interval. This here would be our third interval, right? This here would be our fourth interval, and each interval is 1 minute. This here would be our fifth interval. This here would be our sixth interval, our seventh interval, our eighth interval, our ninth interval, and so on, and our 10th interval, okay? In this case, in this example that I'm providing you all with, there's 10 intervals, they're each 1 minute, and the total observation period is a 10-minute observation period. Well, with interval DRO, what we do is basically we say, if the problem behavior did not occur at all during the predetermined time interval, then we reinforce, we provide reinforcement during that specific interval, okay? So what we're going to look at is, in this specific interval, did the behavior occur? If it did occur at any given moment in that interval, no reinforcement is delivered. If the behavior does not occur during that specific interval, then reinforcement is delivered, and so on. Okay, and then what happens with interval DRO is, if problem behavior occurs during the time interval, no reinforcement is delivered, and then the interval restarts. So basically, if you have a 1 minute period that we're observing, and we're trying to see if problem behavior does not occur for that 1 minute, let's say that at second 25, the behavior occurs. Well, then at that 25 second, I'm going to restart my timer, and I'm going to say, okay, I'm going to start timing again for 1 minute. That behavior has to not occur for that next 1 minute for me to deliver reinforcement. If the behavior does not occur for that 1 minute, I deliver reinforcement. If at any point during that 1 minute the behavior occurs, then I again reset my timer, and we start over the 1 minute period again. Okay, and then momentary DRO is when we have the absence of a problem behavior at a predetermined moment in time, okay, and that's when we will deliver reinforcement. So basically, let's say, let me get a different color here. For momentary DRO, I'm only going to be checking at specific periods whether the behavior is occurring or not occurring, okay? So in this case, at the end of an interval, okay? I could do it at the end of an interval. At the end of an interval, I'm going to check to see if the behavior is occurring or not occurring. If at the end of that interval I check and a behavior is occurring, the problem behavior is occurring, I'm not going to deliver reinforcement. And I'm going to wait until the next end of right? So like, let's say, I'll start over again. So let's say that all of minute 1 passed and the behavior did not occur. I'm going to deliver reinforcement. So we'll deliver reinforcement here. Now I'm going to wait to see, oops, I think I might have said that wrong. During this entire period, I'm not going to be observing to see if the behavior occurs or not. Now I'm going to look up only at the 1 minute period, and I'm going to see if the behavior is occurring at that 1 minute mark. Okay. And now for this next minute here, I'm not going to be looking. I'm only going to look at the 2 minute mark. At the 2 minute mark, I'm going to see, is the problem behavior occurring or is it not occurring? If the problem behavior is not occurring at the 2 minute mark, I will go ahead and deliver reinforcement. But if the problem behavior is occurring at the 2 minute mark, I will not deliver reinforcement. And I'm not going to check again until the 3 minute mark. Now I'll look up again at the 3 minute mark, and I'll see, is the behavior occurring or is it not occurring? That's basically all that momentary DRO is. We're just seeing at a specific period in time in the interval, Is the behavior occurring or is it not occurring? I don't care what other behaviors the client is engaging in. I don't care if they're engaging in other topographies of problem behavior or if they're engaging in other appropriate behaviors. I'm going to deliver reinforcement if they're not engaging in the specific behavior that we're targeting for reduction. If they are engaging in that specific behavior that we're targeting for reduction, then they don't earn reinforcement. And that's all it is. Okay, so I have some more examples for you on the next slides. Okay, so first let's talk about fixed interval DRO, or FIDRO. And a fixed interval DRO is basically when we establish a standard interval of time and then we deliver reinforcement only at the end of that interval if problem behavior didn't occur during the entire interval. So if you have a 1 minute period, you're going to be observing to see if the behavior occurs at all during that 1 minute period. And if it does not occur, then you go ahead and you deliver reinforcement at the end of the interval. And then you'll start your timer again for the next 1 minute period, and so on and so forth. And you'll conduct observations throughout 1 minute periods. Now, let's say that the problem behavior does occur. If the problem behavior occurs, then you're going to go ahead and stop your timer. You are not going to deliver reinforcement, and you're going to reset your timer to a 1 minute interval again. And you're going to basically wait for another opportunity where there's a full 1 minute interval without the problem behavior so you can deliver reinforcement. When you're using an interval DRO, it's very important that you gradually thin the DRO interval schedule and then also the treatment session length as the problem behavior continues to improve. So if you're seeing improvements with your client's behavior, then you want to, make sure that basically they can go longer periods without engaging in the problem behavior. And you're not going to expect them to go from 1 minute to 10 minutes without engaging in the problem behavior. So you want to do, maybe like a 1 minute period initially, and then gradually increase to a 2 minute period, once they've mastered that and they're not engaging in the problem behavior consistently across 2 minute intervals, then you can increase to 3 minutes and so on and so forth. So that they can be successful with not engaging in the problem behavior and also being able to contact reinforcement for not engaging in the problem behavior. And as I mentioned, you don't want to thin that schedule too quickly. You want to make sure that they're still able to access reinforcement consistently and that it's not too effortful to access reinforcement, because once it becomes too effortful to access reinforcement, then they'll stop engaging in the behavior altogether, and they'll start engaging in the problem behavior instead. Then we have variable interval DRO, which is the opposite of fixed interval. With fixed interval, we're specifically saying exactly how long each interval is going to be, whereas with variable interval DRO, it's more unpredictable, and you establish a random sequence of varied time intervals. So one of them might be 1 minute long, the other one might be 30 seconds long before they access reinforcement for not engaging in the behavior. The other one might be 2 minutes long before they can access reinforcement for not engaging in the behavior, and so on and so forth. And then again, you're going to deliver reinforcement at the end of each of these intervals if problem behavior does not occur. And this is helpful because the client really doesn't know when the reinforcement is coming, but you definitely want to be considerate of the reinforcement schedule so that you don't inadvertently thin the reinforcement schedule too quickly and you're making it more effortful to access the reinforcer, and thereby the problem behavior begins to increase. Okay, now we're going to jump into talking about the different variations of momentary DRO, which, if you recall, momentary DRO I described as it being when you deliver reinforcement for the absence of the problem behavior at the end of an interval, okay? So let's look into the different variations. Okay, so the first variation is we have fixed momentary DRO, or FMDRO, and FMDRO is when we establish a standard interval of time. So let's say the 1 minute intervals. This is that example I gave you on the initial slide. You can have those 1 minute intervals, and then you're going to look at the end of the 1 minute interval. Are they engaging in the behavior or are they not engaging in the behavior? If they're not, go ahead and deliver reinforcement. And if they are, then wait until the end of the next interval to see if they are engaging in the behavior or not. And then we have, again, a variable momentary DRO. And the variable momentary DRO is going to be similar to the variable interval DRO, except with the variable momentary DRO, we are not concerned about whether they're engaging in the behavior throughout the entire interval, whether they are engaging in the behavior throughout the interval or not, we are concerned about whether they're engaging in the behavior at the specific time in which you are observing, and which is usually at the end of the interval. So with variable momentary DRO, the intervals can vary in time. You can have a 1 minute interval, you can have a 30-second interval, you can have a 10-minute interval, a 5-minute interval, whatever it might be. You are only going to be observing at the end of the interval in order to be able to deliver reinforcement if the problem behavior is not occurring. The advantages of using a variable momentary DRO are that the practitioner does not need to monitor the behavior at all times. Basically, you can be engaging in, different tasks, and then, kind of when you remember, you look up and you see is the client engaging in the behavior or are they not engaging in the behavior. And then also the participant may obtain higher overall rates of reinforcement because it's basically you're just catching them in that specific moment and delivering reinforcement if they're not engaging in the behavior. So now we're going to discuss the specific guidelines for using DRO. So first, you want to make sure that you are selecting initial DRO intervals that ensure frequent reinforcement. You want to make sure that you are not inadvertently reinforcing undesirable behaviors. You want to gradually increase the DRO interval. You want to extend the application of DRO to other settings and times of day. You want to combine DRO with other procedures, and you want to recognize the limitations of DRO. And so we will talk about each of these in more detail in the next few slides. Okay, so the first guideline for designing a DRO intervention tells us that we need to set an initial DRO interval that ensures frequent reinforcement. And so to establish an initial DRO time interval, we need to ensure that the learner's current level of behavior is going to contact reinforcement when the contingency is applied. So how exactly do we do this? Well, we figure out the appropriate interval duration by looking at our baseline data. So basically, we will conduct an observation. We will collect baseline data. We'll see how often is this behavior occurring. And then not only how often is the behavior occurring, but how far apart from each other is this behavior occurring. So this is what we call the inter-response time. And I'll show you guys that in the next slide. You're going to basically decide on the initial duration of the intervals by looking at the inter-response time of the problem behavior. Okay, so inter-response time, or IRT, is the average amount of time that elapses between displays of inappropriate behavior. So as I mentioned, you have to observe the behavior, right? Conduct like a baseline of sorts to see how often the behavior is occurring. Okay, you're going to collect IRT data. You're going to calculate the IRT in order to determine the appropriate length of the interval for the DRO, and we use this also for DRL schedules, which you'll learn about DRL later. But you are going to use this average of time, that elapses between the different inappropriate behavior, and that's what's going to guide the length of time of each interval. You basically want the interval time to be slightly lower than your inter-response time. So let's say that you have a client that engages in a maladaptive behavior on average every 5 minutes. That would be the inter-response time. The inter-response time would be 5 minutes. So, one response occurs, the 5 minutes pass in between the next response. If they engage in that response, in that problem behavior every 5 minutes on average, then basically you would want to set your interval slightly lower than that. So maybe every 3 minutes you would set your DRO intervals so that you are able to provide reinforcement for the client not engaging in the behavior. That way you're reducing the motivation to even engage in the problem behavior because they're accessing that reinforcer very frequently throughout the period that you are delivering the DRO intervention. Also, one of the risks with a DRO intervention is that you may, when it's time for you to deliver reinforcement, another problem behavior, not the problem behavior that you're targeting for reduction, but another problem behavior or another undesirable behavior may be occurring when it's time for you to deliver reinforcement. So if that does happen, technically, quote unquote, based off of the DRO intervention's definition, we should deliver reinforcement, but you can try to not reinforce those undesirable behaviors whenever possible. You can try to delay your reinforcement so that you are delivering reinforcement, slightly after the behavior occurs, the undesirable behavior occurs, so that you're not reinforcing other maladaptive behaviors. You also want to make sure that when you're selecting the behavior for your DRO intervention, that you're selecting the most challenging behavior, because other behaviors may occur also throughout the interval, and so you don't want to inadvertently reinforce those other problem behaviors that you're not necessarily targeting for decrease. So whenever possible, you want to deliver reinforcement contingent on the absence of the problem behavior that you are targeting for reduction, and if possible, also deliver reinforcement contingent on the absence of any other significant inappropriate behaviors. If you can delay delivering reinforcement until none of these problem behaviors are occurring, that would be the best, because otherwise you would be delivering reinforcement for a different problem behavior, which means that behavior is going to be maintained and more likely to be occurring in the future because you're delivering reinforcement for it. Okay, so once a person is consistently not engaging in the problem behavior, because you are delivering reinforcement for the absence of the problem behavior, then you want to start gradually increasing the DRO interval. Okay, let's say that you had intervals that were 3 minutes long. The behavior has not been occurring for those 3 minutes consistently. You've been delivering reinforcement. The behavior is absent. Then you can start gradually increasing. So you would go from, let's say, 3 minutes to 5 minute intervals. And then from, once they're able to tolerate 5 minute intervals without engaging in the problem behavior consistently, then you can go ahead and increase maybe to 7 minute intervals or 10 minute intervals. But you want to make sure that you're not increasing the duration of the intervals too quickly. It has to be a gradual increase. Otherwise, the client won't be contacting that reinforcer, and then they might resort to engaging in the maladaptive behavior again in order to gain access to that reinforcer. Okay, so three suggested procedures for increasing the duration of the DRO interval would be that you can increase the DRO interval by a constant duration of time, so you can increase by 2 minutes each time, or you can increase the intervals proportionately, or you can change the DRO intervals each session based on the learner's performance. Okay, and then once you have thinned your schedule of differential reinforcement or your intervals, you've thinned them enough, you've separated them enough, you want to start considering generalizing your DRO application to different settings or to different people, different times of day, etc. So when the frequency of the problem behavior is reduced substantially in a treatment setting, the DRO intervention can be introduced during other activities and times. And then teachers, parents, or caregivers can begin to deliver reinforcement on the DRO schedule to help extend the effects. Generalization is a key component of any of our interventions. It's wonderful if our clients behave great with us, and we can have all of their behaviors under control, and we have stimulus control over their behaviors, etc. That's amazing. But what's even better than that is when we can have their caregivers, their teachers, their all their stakeholders, the people that are interacting with them on a day-to-day basis when we're not there, if they can all carry out those interventions, that would be the ideal situation. And so whenever you're reaching kind of the end of an intervention, or where you're able to get an intervention to the point where you're able to introduce it into the natural environment, you definitely want to make sure that you are not just focusing on getting the intervention generalized into the natural environment and natural setting, but also that you're training those different stakeholders to be able to implement the intervention. Okay, and then lastly, one of the things that we can do to improve our DRO interventions would be to combine DRO with other procedures. So we talked about this with DRA. Well, with DRO, we can include DROs in a treatment package with other behavior reduction procedures to yield more efficient and effective behavioral change, just like with DRA. So with DRA, I mentioned that you can use punishment, you can use response cost, whatever different behavior reduction strategies we discussed, well, you can use those same ones with DRO. And then DRO can also be added as a supplement to an intervention that has produced insufficient results. Okay, so now let's review what the limitations of DRO are, and these limitations are going to be specific to the different variations of each, okay? And I've kind of talked about these, but I'll make sure to go over them in detail anyway, just so that I don't miss any specific limitations. So with interval DRO, reinforcement is contingent only on the absence of the problem behavior. So another inappropriate behavior might have occurred during that time and may be inadvertently strengthened, right? Because with interval DRO, we're looking at whether they engage in the behavior throughout the entire interval. Well, it's possible that they engage in another behavior throughout that interval. So in those cases, what you can do is you can try to expand your definition of your problem behavior to include some of those other maladaptive behaviors that are occurring in that, that you're observing, so that you don't reinforce those behaviors. And then the length of the DRO interval can also be shortened so that you don't see those other maladaptive behaviors occurring, just so that we're not inadvertently reinforcing different topographies of behavior or different maladaptive behaviors that weren't originally included in the definition for the behavior that you were targeting for reduction. So with momentary DRO, this is the one that I've been talking about mostly. Reinforcement might occur. Reinforcement for a problem behavior that's not your not your target behavior might occur at the end of the interval. So when you look up to see if the behavior is occurring, you might say, okay, the problem behavior that I'm targeting is not occurring, but there's another behavior that's occurring. And so if another inappropriate behavior is occurring during the end of the interval, it might be strengthened if you provide reinforcement at that specific time. And so what you can do is use interval DRO and then reduce the length of the DRO interval. Okay, so if you are using momentary DRO and you find that every time that you reach the end of the interval, the specific problem behavior you're targeting is not occurring, but another problem behavior is occurring, you wouldn't want to deliver reinforcement. Instead, you want to look at switching into an interval DRO where you're looking at the entire period rather than just at the end of the interval, and then reduce the length of that DRO interval. You can also go back and collect data to see what's the best interval time to set. So we talked about that inter-response time. You can collect data to find out the average inter-response time between the problem behavior, and then use that to decide on what's that DRO interval that you're going to set. And then lastly, when you're going to implement a DRO intervention, you want to definitely make sure that you are considering the resources that are available to you, the intensity of the DRO procedure, whether the person, whoever the implementer is, can dedicate the amount of time that's necessary for the DRO intervention, because the DRO intervention can be time intensive, sometimes they're labor intensive, especially if you're conducting an interval DRO where they have to watch the entire behavior in order to, during the specific intervals where you have to watch the entire interval to see if the behavior occurs during the interval in order to deliver reinforcement or not. So if you assess your resources that are available to you and you see that you don't have the staff available, let's say, to implement such an intervention, well, then you want to consider other interventions that are more likely to be implemented in the way that you intend for them to be implemented. Because you want to make sure that you have high procedural fidelity or treatment integrity, which means that your intervention is implemented in the way that it was designed to be implemented. If you don't have the staff resources, people don't have the time to dedicate to this, it's not going to be implemented appropriately. You're going to have poor treatment fidelity, and then your results are not going to be good. And the reason, actually, before I move on to the other slide, the reason your results won't be good is because if the person's not implementing the procedure appropriately, that behavior is going to continue to contact reinforcement intermittently. And we know that intermittent reinforcement is what's going to maintain our behaviors occurring over time. Okay, so now we're going to jump into a different procedural variation of differential reinforcement. So we've talked about DRA, we've talked about DRI, and we've talked about DRO. Now I want to talk to you guys about DRL. So this is differential reinforcement of low rates of responding. And DRL is a variation of differential reinforcement that we use when we have a behavior that's occurring in a person's repertoire, but it's occurring in excess. Okay, it's occurring too often, and it might not necessarily be a problem behavior on its own. The problem is how often it's occurring. And because it's occurring so often, it is a problem. Okay, so I can give you guys an example of a behavior that would be, that might be appropriate for a DRL intervention. In the past, I worked at a clinic where we had a client. It wasn't my client directly, but there was a client at this clinic that I worked at that would rub her nose. Okay, and rubbing a nose is a regular behavior. It generally would not be considered a problem behavior. She would rub her nose in a downward motion. She would start at the top of her nose and move her hand down towards her cheek. And it was kind of like a sliding motion down toward her cheek. And this behavior, like I said, is not necessarily a problem behavior for most people. Most people actually engage in this behavior probably on a daily basis. But this client would engage in this behavior probably hundreds of times per hour, which resulted in the tissue around her eyes becoming swollen. And then her eyes, if she would do it often enough, her eyes would become swollen and they would close shut, which could eventually, affect her vision, could cause tissue damage, etc. So it was a behavioral excess. The topography of the behavior itself is not necessarily a concern. It's the frequency within which she was engaging in the behavior that's a concern. And so that behavior, we can consider different interventions, obviously depending on the severity of the behavior. Maybe we consider that a punishment intervention is more effective because of the gravity of the consequence of the behavior, right? If we're considering that the behavior can result in tissue damage, and loss of vision, etc., maybe an intervention like punishment might be more effective. But that behavior might also be a good candidate for because I've mentioned to you guys that there will be instances, very few, but there will be some instances where a punishment intervention might be considered first. Usually we try to resort to reinforcement-based interventions first, but if a behavior is severe enough, we might consider using a punishment-based intervention first. And if it's less severe, then we can generally do a reinforcement-based intervention. So if we were to use the reinforcement-based intervention, we could use differential reinforcement of low rates of behavior for a behavior like that. Okay? Low rates of responding. So what that would look like would be for us to identify what that inter-response time is. And basically, once we know what the inter-response time is, we would set a criteria that's lower. Like, let's say the behavior is occurring on average every minute. So there is one response almost every minute. What we could do is we could design our intervention so that we are setting a criteria where that behavior now needs to occur, in order to access reinforcement, they need to engage in that behavior only, after a minute and 15 seconds has elapsed. So what you'll do is, following each occurrence of the target behavior that is separated from the previous response by a minute amount of time, or you'll deliver reinforcement after it's separated by a minimum amount of time, or contingent on the number of responses within a period not exceeding a predetermined criterion. So that's what differential reinforcement of low rates would look like. So for the first example, we could say, okay, if they engage in the behavior, each response is separated by a minute and 15 seconds, they'll receive reinforcement. And then once they master that, then it'll be, after every 2 minutes, where the behavior needs to be separated by 2 minutes. So you can engage in the response of touching your nose, and then you can engage in the next response until after 2 minutes have passed. So what we try to do is we try to gradually increase the amount of time within which they engage in those responses. Or alternatively, we could do the second option for DRL, which is where you collect baseline on how often a behavior is occurring during a specific observation period. So let's say in an hour, they engage in the behavior 60 times, okay? And I might say, okay, in order to now access reinforcement or to deliver reinforcement, the behavior has to occur 55 times or less. Okay, and so then once the client masters engaging in the behavior 55 times or less, we would say, okay, we would move on to the next step, and we would say, okay, now they have to engage in the behavior 50 times or less in 1 hour. And then once that's mastered, you move on to 40 times or less in 1 hour, and then, and so on. You can designate the criteria for gradually fading out, or gradually reducing or differentially reinforcing those low rates. Okay, so we use DRL to decrease the rate of a behavior that occurs too frequently, but we don't want to eliminate the behavior entirely. Another example where we might want to use DRL would be, I see this in classrooms all the time. We have sometimes kids that will raise their hand excessively. Okay, raising your hand is not a problem behavior typically, but it can be if you're raising your hand and asking questions too often. And so we can implement a differential reinforcement of low rates of responding where we try to, let's say, reduce hand raising from 20 times per hour to 5 times per hour, which is a more appropriate level maybe for a teacher, and it's more likely to get reinforced. So there are 3 types of differential reinforcement of low rates of responding. Those are full session DRL, interval DRL, and then spaced responding DRL. So for full session DRL, reinforcement is going to be delivered when responding during an entire session is equal to or below a predetermined criteria. And then reinforcement is withheld when the number of responses exceeds that specified limit during the session. So let's say that you have, you work with a client for 3 hours. Okay, a full session DRL would look like you tracking how often they engage in the problem behavior for that full session. You would have already had a specific criteria that you set prior to your session of how many times that client is allowed to engage in that behavior. And then at the end of the session, you're going to see how often did they engage in that behavior. If they engage in that behavior lower than the threshold that you set, then you'll go ahead and deliver reinforcement. And if they exceeded that threshold that you set, then you will not deliver reinforcement. Next, we have interval DRL, which is going to be similar to the intervals that we described for the DRO procedures. Okay, so we're going to divide the total session into a series of equal intervals of time. And then you're going to provide reinforcement at the end of each interval in which the number of occurrences of behavior was equal to or below a criterion limit. So it's going to be really similar to the full session DRL, except instead of it being you delivering reinforcement based off of how many times the behavior occurred in the full session, you're instead looking at the criteria that you set for the interval. Okay, maybe you said in a specific interval they're allowed to engage in the behavior 3 times or less in order to access reinforcement. If they engage in the behavior 4 times or more, they will not receive reinforcement. And you're going to do this for every specific interval. You will deliver reinforcement or not deliver reinforcement. If the learner exceeds the criterion, the practitioner removes the opportunity for reinforcement and then begins a new interval. And then lastly, we have the spaced responding DRL, which is the one that I described to you earlier where you look at the inter-response time. Okay, so with spaced responding DRL, the practitioner delivers a reinforcer following an occurrence of a response that is separated from the previous response by at least a specified amount of time. So here we look at inter-response time, which is a duration between 2 responses. The longer the inter-response time means that the lower the overall rate of responding is, and then shorter inter-response time correlates with higher response rates. Because as I mentioned, the inter-response time is basically how long a client is going before engaging in the next response, in the next instance of problem behavior. So when reinforcement is contingent on longer inter-response times, response rate will decrease. Okay, and now to finish off this presentation, I'm going to review the guidelines for using DRL. So when you are using DRL, you want to make sure that you choose the most appropriate DRL procedure. So you want to use spaced responding DRL to reduce the occurrences of a behavior while maintaining those behaviors at lower rates. I explained to you, you can use spaced responding DRL, let's say for a client that is raising their hand too frequently, and maybe you want them to wait 5 minutes before raising their hand the next time. You can apply full session DRL or interval DRL when it is acceptable that the rate of the problem behavior reaches 0 or as an initial step towards the goal of eliminating the behavior. And then spaced responding and interval DRL may be appropriate and often necessary for learners with severe problem behaviors. Which I explained this in, when I first introduced DRL to you guys. I also mentioned, if it's a really, really severe problem behavior, you definitely want to consider the consequences of the behavior and the impact that it might have on the client. And as I said, sometimes if it's a really severe form of problem behavior, jumping straight into a punishment procedure might be appropriate for the client because the behavior will be reduced much sooner, which will reduce the risk of the side effects that the behavior might be producing. So, those are ethical considerations, and you all are taking, an ethics course or have taken an ethics course. And so you should have learned about the applications of punishment versus using, reinforcement-based interventions first. So you definitely want to recognize the limitations, of DRL. And as I mentioned, if you have a behavior that you want to reduce very, very quickly, differential reinforcement of lower rates of responding might not be your first method of choice, okay? DRL should not be used with self-injurious, violent, or potentially dangerous behaviors because you're basically allowing the behavior to continue to occur and you're just reducing it very gradually or slowly, and that's not always, typically what you need in those situations, okay? From a practical standpoint, using DRL means the practitioner must focus on the inappropriate behavior and may unintentionally give too much attention for the inappropriate behavior, which if your behavior is maintained by attention, then you may be inadvertently reinforcing the behavior. So definitely be cautious with that. And also, it may be difficult to apply the interval DRL procedure in group settings. So keep that in mind. As I mentioned earlier, when you are selecting those initial intervals or when you are deciding on your DRL criterions, then you want to make sure that you've collected baseline data. That should always be the first step with any intervention is collect your baseline data. The baseline data is going to guide you through how to design your intervention. Okay, and then as I've mentioned earlier when we were talking about DRL, I gave you guys an example of this. And I've also talked about it with DRO. You always want to make sure that once you are seeing progress with your intervention, that you are gradually thinning your DRL schedule. And this will apply for your full session DRL, your interval DRL, and your spaced responding DRL. Okay, and then now let's talk about how to decide on whether, it's okay to thin the schedule or not. So, when you are deciding to thin the schedule, you definitely want it to be a data-based decision. You are going to be looking at the data to guide when you're ready to move on. Okay, so rule number 1 says change the DRL criterion whenever the learner meets or exceeds the criterion for 3 consecutive sessions. So if you set a criterion for a full session DRL and you said my client is allowed to engage in the behavior 10 or fewer times during this, session, then if they meet that criteria 3 consecutive times, you can go ahead and reduce to the next step. So if your next step is they can engage in the behavior 8 times or fewer, then you would go ahead and move on to that. And then rule number 2 says change the DRL criterion whenever the learner receives reinforcement for at least 90% of the opportunities for 3 consecutive sessions. And then lastly, to enhance your DRL procedure, you can provide feedback to your learner. So I actually think this is something you can do with a lot of the different interventions that you implement. You can let your client know what their contingency is, right? What is the contingency that's at play? What's the intervention that you are implementing? Sometimes by just letting them know the intervention, you're more likely to see better results. So in this case, the effectiveness of a DRL procedure can be enhanced by feedback to your learner in order to help them learn and in order to help the learner monitor their rate of responding. Okay, you can let them know this time you're only going to receive reinforcement if you engage in the behavior 10 or fewer times. And so they can learn to track their behavior. They can learn to see whether they're on track to receive reinforcement or not. And it's going to get them a little bit more motivated to hit that goal or stay below that goal. Okay, so now to wrap up this presentation, I want to very quickly cover or compare the different differential reinforcement procedures that we've talked about in today's lecture. So the first 2 that I talked about were DRA and DRI. So both DRA and DRI are going to focus on strengthening appropriate behaviors. And we're teaching a specific alternative behavior, whereas DRO and DRL do not. Okay. With DRO, again, we're just reinforcing the absence of the behavior. And then with DRL, it's the reduced rate that's being reinforced. Okay. DRL is the only differential reinforcement intervention that allows reinforcement even though the inappropriate behavior surfaces. And I want to say this it has a caveat, right? Because you can have differential reinforcement of alternative behaviors without extinction. As I mentioned, that in most cases, most people think of it and they think of it with extinction, but you can have it without extinction, which is when a person delivers low quality reinforcement for the problem behavior, and then because of the matching law, that behavior will still reduce because the alternative appropriate behavior is receiving such high quality reinforcement. Okay, and then the last bullet says that DRI, DRA, and DRL typically result in gradual behavior changes, which we mentioned earlier as well. Okay, so now I have some quick questions to just check your knowledge. So which differential reinforcement is described here? Zoe will be reinforced for signing, or Zoe's behavior will be reinforced for signing give me instead of grabbing items from people. Is it DRA, DRI, DRL, or DRO? Okay, so in that example, the correct answer was differential reinforcement of alternative behavior, because the appropriate behavior or communication response of give me was taught in place of the maladaptive behavior. And this type of differential reinforcement of alternative behavior, where we are teaching a communication response, okay, a functional communication response in place of the problem behavior, that is a type of differential reinforcement called functional communication training, or FCT. And all it is that once we know the function of the problem behavior, right, we can teach an appropriate communicative form for the client to engage in instead of the problem behavior. So the different examples that I've given you throughout today's presentation, if you have a client that's engaging in problem behavior for escape, we can teach them to request escape. We can teach them to say, I need a break. Or if you have a client that's, engaging in problem behavior because a task is too difficult, we can teach them to communicate, I need help. Those are functional communication responses that we are teaching and that we are reinforcing in place of the problem behavior. And it is considered differential reinforcement of alternative behavior, but if we want to be more specific and precise about the type of DRA, it's called functional communication training, or FCT, which is basically we're teaching a communication response in place of problem behavior, and that's being reinforced rather than the maladaptive behavior. And with this, I will finish off the presentation on differential reinforcement. Thank you all for listening, and I hope this was helpful.